Good afternoon, everyone. My name is Ashley Delahoussaye, and I am a kinesiology major in exercise science clinical health. And my research proposal is over the physiological effects of wearing a protective face mask during maximal exercise. A little bit of background information is that minute ventilation is the tidal volume, which is the amount of air moving in and out of the lungs, times the frequency, which is the number of breaths being taken in a minute. During inspiration, the oxygen that is being consumed travels through the blood to supply organs and muscles while getting rid of metabolic waste such as hydrogen ions and carbon dioxide. When there is a reduction in gradient, the oxygen that is being delivered to the exercising muscles will be decreased, resulting in hypoxia. While an increase in carbon dioxide in the blood can generate hypercapnia, proceeding to increase ventilation, which is to increase the removal of carbon dioxide. It is hypothesized that during maximal exercise, a protective face mask that is used during the pandemic will impair ventilation and increase carbon dioxide levels in the body, increasing the risk for other physiological impairments. The purpose of this study is to determine if there were any physiological impairments in response to maximal exercise while wearing a protective face mask. For this study, 8 healthy males were used from the University of Texas at Arlington, volunteered to participate in 2 maximal exercise tests on a treadmill using the Bruce protocol. One of the exercise tests required the subject to wear an N95 mask while the other did not. The order of these tests were at random, and they were at least a week apart, allowing for rest and recovery. A spirometry mask that covers the nose and mouth were used for both tests, and while the N95 mask was used, it was placed over that mask during the maximal exercise test. A metabolic cart was used to determine the oxygen consumption, carbon dioxide consumption, and ventilation, while a heart rate monitor was worn during the test to determine the heart rate throughout. A rate of perceived exertion scale was used, where a 6 represented rest and a 20 represented maximal exertion. Due to the spirometry mask and not being able to talk, hand signals were used to communicate the thumbs up, indicating that the subject could still continue with exercise, or a hand wiggle or palm down, indicating that they could no longer go. Once the hand signal of the palm down or the wiggling was used, they were asked to continue for at least 30 seconds or into the next workload, allowing the collection of the final or maximal values. The treadmill was then set to recovery mode, allowing the subjects to slow down while continuing to monitor heart rate and blood pressure. Once their heart rate was below 120 beats per minute, or the systolic blood pressure was below 130, and they felt like they were recovered, they were asked to schedule their next appointment and were able to leave the lab. During the test, every 3 minutes, data was collected, and an alpha level of significance was set at 0.05 to determine if there were any significant differences. The results of this study indicated that there is an increase in end-tidal volume of carbon dioxide and an increase in partial pressure of carbon dioxide while performing maximal exercise and wearing a protective face mask. This could lead to the increased risk of peripheral dilation, resulting in acidosis, which causes headaches, confusion, anxiety, blurred vision, and more. Patients with pulmonary comorbidities, such as asthma or chronic obstructive pulmonary disease, known as COPD, could be affected more due to the decrease of maximum forced vital capacity, forced expiratory volume in 1 second, and peak expiratory flow. Since there is an increase in stress, there could be an elevation in workload breathing, which could decrease ventilation due to the decrease in tidal volume and frequency. There's also a potential decrease for maximal oxygen uptake and maximal power, indicating a decrease in performance. These effects could occur because of the contribution of rebreathing carbon dioxide that is left in the mask, causing hypercapnia. Lastly, temperature could also be a limiting factor to comfort and alternating the physiological responses during maximal exercise. Thank you.